my daughter was about 5, I was able to tell her the story of what happened to me. Not that she has a real clear memory. She was 1 or 2 at the time, and I don't think she remembers everything specifically. But I was able to tell her what happened and how it happened and that I was sick for a while in a way that she could comprehend. So now, because she knows that a dirty needle infected me, she's able to then advocate for herself, and she goes in for her yearly, flu shot, or she'll go in for a vaccine, and she'll be able to look at the healthcare worker and she'll be able to ask, is that a clean needle? Is that a new, syringe? In the spring of 2009, I was living in Denver, Colorado. I had had routine surgery about 6 weeks before, and I had gotten, almost deathly ill. Like, I was not able to even leave the house at times. I was so fatigued. I was nauseous. I was just unable to really function. I was the parent of a 1-year-old and trying to keep a full-time job, and it was difficult. And it wasn't until a bunch of blood tests and a bunch of questions that we really were able to find the source, and that I had hepatitis C. The problem was we couldn't figure out why or how someone with no risk factors could be infected. And so that took a lot more time. So really being able to isolate where it came from and how it started, that took the involvement of not only the state health department, but also the CDC coming in to investigate. I happened to be one of 2 patients who were infected with hepatitis C a day apart. We had had surgery at the same hospital. And so they were able to isolate that it was at that hospital, and then through their investigation were able to understand that it was a person who was an employee, who was also a drug addict, who also had hepatitis C, who was diverting those drugs for her own personal use.
As a nurse and as an attorney, I've been exposed to this type of issue over the years. I had a very close friend who diverted medication, controlled medication throughout his career, and he ultimately overdosed and died. So I have a personal impetus to be involved in this type of work. Drug diversion is stealing medication from hospitals or healthcare facilities for personal use. That's healthcare provider diversion, specifically within healthcare facilities. So it's stealing the medications that are at the facility and taking them for personal use, or in certain circumstances maybe giving them to someone else, like a loved one or a partner. Who is typically involved in drug diversion? That is something that oftentimes surprises people. People who get involved in healthcare facility diversion are typically healthcare personnel who are very high performers. They're very well liked, and they don't fit a stereotype of someone who is stealing medication from a healthcare facility and abusing drugs.
I don't know where to start, so I guess I'll start with the day that Susan found me in the bathroom passed out over the toilet. The needle was still sticking out from my arm. I was on a break from my shift in the ICU when I went to go inject fentanyl. I was hoping it would get rid of the pain in my foot and ease that craving in my head. I didn't expect Susan to come looking for me because nobody ever had to worry about me at work. My boss called me the best nurse on the unit. I was always at work before anyone else, and I was always happy to help wherever help was needed. When Susan found me in the bathroom, I was so embarrassed. All my coworkers were whispering and staring as they took me down to the ER. Susan told me to meet her in the Human Resources office. When I got there, the rep showed me pages and pages of reports they'd gathered on me that showed the number of times I accessed narcotics from the Pyxis machine. I wondered how I let it get this far. They suspended me right away that afternoon. I knew I was in big trouble. So I called Susan when I got home and I resigned. That way I wouldn't have a record of being fired. The whole situation was terrible, but not as terrible as finally facing the fact that I was an addict. I am an addict.
People have been diverting drugs, and outbreaks have been happening well before mine happened and even after. I think it's the lack of hospital administrations being able to have a policy in place that they can enforce, or that they're not holding the right people accountable, or they don't have the right system to account for drugs being used and signed out. So it's so preventable. I talked with an administrator at a hospital right after this happened, and he told me straight out, Lauren, it's not if this will happen, it's when it will happen.
What hospitals can do to help control diversion is to educate all of their staff, make them aware that this is a very common type of incident to happen within healthcare institutions, and also that there are very substantial patient safety and staff safety risks. For patients, they may be denied effective pain relief, they may be cared for by an impaired provider, or they may even contract a bloodborne disease because of tampering with injectables. For staff, they can certainly have very substantial professional implications, but they can also suffer from, the physical effects of opioid abuse, including and up to death.
I think the key policies really revolve around the dispensing of a controlled substance. So checking out that controlled substance from a machine or from a computerized system where there is a tracking or there is a record of who took it out when, and then being able to keep that drug in the possession of the anesthesiologist or under lock and key until it's needed. You think you know the people who are working around you, but you don't always, and you don't always see the signs, or you're working in one OR in one hospital this day and then another surgical team another day. You don't always know the people who are surrounded. So really being able to have that accountability. Where did that drug go? At what time? What time was it used? And where was it in between?
I'm not your stereotypical addict. My parents weren't addicts. I graduated from nursing school. I married my boyfriend, Sam. I've always had anxiety, but I managed to keep it under control. I really liked hiking with Sam. It would make me feel so much better, except for the one day on a hike that I fell and broke my foot. The pain was the worst I ever had. They took me to surgery, which was a blur, and when I left the hospital, I had a prescription for Vicodin. You would think not working for a month would be nice, but it put a huge strain on our finances, which made my anxiety worse. When I was able to start working again, I worked as many shifts as possible to make up for the lost income. The money was great, but the extra work took a toll on my foot. It just hurt. The last Vicodin from that prescription went down really easy, but I panicked when I saw that empty bottle in the trash can. I didn't know if I could stand the pain of working on my feet for 12 hours. About a month after I stopped taking the Vicodin, our unit was understaffed, and I was running back and forth between 5 patients. I remember going to the bathroom, and as soon as I shut the stall door, Christina, another nurse, ran in to tell me my patient was pulling out all of his catheters. I just wanted to scream. I need a minute off my feet. After I situated my patient, I offered him his 2 Percocet pills, and he just looked at me and said, "I only need one of those, you idiot." It was like he stabbed a dagger right in my sore foot. Here he had 2 pills. He only wanted 1, and I was in pain. And I wanted that other pill. When I left the room, I took that pill and I put it in my mouth and I swallowed it. Washed it down with a sip of water and it was gone. And then I documented that I administered both pills to the patient. From then on, stealing pills was easy. Every time I would document 2 doses given, but I would save 1 pill for myself. Sam noticed I was coming home in way better mood. I never told him what I was doing, though. It was my secret.
If a healthcare worker suspects that a colleague is diverting, The best place to start is to report that immediately to a supervisor. Because there are patient safety implications, it's important to do that immediately and not delay reporting. There are, in some institutions, confidential hotlines where reports can also be made. There are a number of different locations where hospitals can obtain resources for diversion prevention, including state websites such as the Minnesota Hospital Association website, but also professional organizations such as the International Health Facility Diversion Association.
There needs to be a system in place or a peer assistance program in place at hospitals or facilities so that it is a soft place for someone to land, that they can not only get the help that they need and patients and other healthcare workers can be safe, but that they are able to be, they're able to get the treatment they need and hopefully come back to a profession that they're trained to do. So it can't just be about throwing them in jail. It can't be about that legal issue of drug diversion. It's got to also be in tandem with that emotional healthcare, I need to help this person issue as well. I talk about peer assistance because I think it's really going to happen at the ground level. Me as a colleague seeing someone who might be struggling or who might be kind of spiraling out of control. And if I can reach out and help that one person, I'm going to be able to help them and so many others. And so I think that the nurse anesthetists do it probably about the best. They have a peer assistant program which really does allow for that one-on-one assistance as well as taking it to the next step. Do they need rehab? Do they need other support? What can we do to help support them get their lives back on track?
Although there are regulations in place, there aren't sufficiently detailed regulations that require facilities to report diversion when it happens to all of the appropriate entities to make sure that an individual who is diverting doesn't go from one facility to the next after they've been caught. I think it's essential that healthcare institutions address diversion as a team, that there be multiple stakeholders at the table, and that everyone work together, particularly that there's a partnership between nursing and pharmacy in advancing the diversion prevention, detection, and response program.
So the woman who was the diverter in my case actually had been working at the hospital that I was infected at 6 months, so prior to my infection. So she had been diverting from day 2 all the way until she ended up quitting. She knew that the writing was on the wall and she quit and tried to get a job at another facility down in the southern part of the state. She had diverted before. She had switched jobs, switched states, and because there wasn't good transparency, or because we could not take information that we already knew about this person and use it as criteria to hire or not hire, she was hired and she was able to do it again. I didn't realize that it could be so easy to get a deadly disease. And I didn't know what my future looked like. I didn't know if I had exposed my daughter. So there was a lot of fear. There was a lot of unanswered questions. So I was in this very uncontrollable situation where I didn't know what was going to happen with my health. I didn't know what was going to happen, in the future. I didn't know how I would respond to the virus. But the one thing I could do, the one thing that I could take back was the power to tell my story and to be out there, to be able to talk about it, to be a name, to be a face, to be able to say, hey, if it happened to me, it might happen to you. You need to be careful.
By 6 months later, I was stealing 3 or 4 pills a day. My coworkers didn't realize that the longer hours I worked and the extra shifts I picked up were so that I could stockpile pills for my days off. Finally, I knew the pills weren't enough anymore, and I decided to try fentanyl to help with the pain. I would walk to the Pyxis machine where the narcotics are stored and dispensed. I select a patient who was receiving fentanyl, hit remove to get the medication out, and quickly hit cancel so that it would appear that I made a mistake. I found it didn't alter the counts, which made it easy to return later. I would put the cartridge into my pocket and go to a private area on the unit and take what I needed. I replaced the contents of what I took, sometimes with saline, sometimes with water, whatever was handy. I didn't care. The pain was gone. Stealing the fentanyl became just another thing I did at work. Just something else I did. I needed it. My body couldn't function without it. I couldn't function without it. I was so eager to get it that I would show up early and leave late just to make sure I could get what I needed. I was a great team player. That's what my coworkers thought. They'd go to lunch, I'd medicate their patients. Need me to pick up a shift and I'll be there. By the time I was using fentanyl 5 times a day, it wasn't a huge surprise to me that Susan walked in on me in the bathroom. I was just another nurse, just another drug diverter.